MRI stands for magnetic resonance imaging. So it's pretty fancy pictures using a magnet to look at all the structures that are inside the body. Got to think of it like a photograph, okay? But one of those old photographs where the exposure goes over like 2 or 3 minutes, because that's what's really happening. We're taking pictures that don't happen in a fraction of a second like you do with a conventional camera. It really is an exposure that goes over several minutes.
My name's Diane, and I'm an MRI technologist here at St. Michael's Hospital. Scans are taken in a series and increments of 5 minutes each. So in between that time, we try to talk to the patients to reassure them that they're doing well and ask them if they're okay. Sometimes if the patient moves around in the scanner or perhaps is a bit claustrophobic, it takes a little longer to get the images.
The image here on the left shows a patient who's moving, and you can see that because the patient is moving during the scan is blurry and degraded by artifact due to the motion. Here on the right side is a patient who's holding still during the examination, and we can see that on this image, the image is sharp and in focus, and that's because the patient was able to hold still. I think it's really important for every MRI examination for patients to try to hold as still as possible. The important thing to keep in mind is that the more that you as the patient are able to cooperate with the exam and hold still, the better the image quality is, and that allows us to see abnormalities more clearly and make more accurate diagnoses. It's the part of the body that we're looking at that really has to be held completely still. So if we're doing an MRI study of the head, then lying still isn't just a matter of having your body still in the magnet, but kind of looking around with your head. You have to really try to hold your head still. And we don't mean so still that you're almost nervous and shaking, but just sort of in a neutral position.
The more you relax, the easier it is to hold still. It's only once you get really nervous about the instructions that you get really tense and start to move.
Always keep in mind that there's a picture going on while that noise is going on, and then to try to suppress any micro movements, even wiggling, swallowing, all the different things that cause movement everywhere in the body. If we can suppress that as much as possible, it ends up being a better study.
The idea is to breathe naturally, relax, try to imagine yourself on a beach somewhere down south where it's nice and warm, and just let us do the hard work while you're inside there.
It's a busy department and there's lots to get done, and there isn't, maybe the message is mixed in with a lot of other messages, like you got to put an armband on, you got to take your watch off, and then and hold still is sort of embedded in the middle of the message. So the purpose of this educational video is to really focus on image quality and what we can do to improve image quality. And we have all the things we do on our end about keeping the machines state-of-the-art, the sequences we use state-of-the-art, using the right contrast materials when we need them. And then, but the part that's missing sometimes is on the patient side, like the very important contribution that patients make by listening carefully to the instructions from the technologist and by really trying their best to hold still, just like you would for a photo shoot, basically. Because that's what this is, right? This is a photo shoot to look inside your body and make a diagnosis.
The concept is that we're partners in this. You can hold as still as possible. That will help everybody on the team, including us as physicians, our technologists, and of course, more than anybody, you, the patient.